Welcome to today's presentation entitled Preparing for Your 2014 Housing Inventory and Point-in-Time Counts. Today's presenters will be Michael Roanhouse, a Division Director from SNAP's office in HUD, William Snow from HUD SNAP's office, and Tom Albanese from Apt Associates. Upon completion of this presentation, participants will be able to understand the changes to the HIC and PIT count in 2014, understand what data must be collected for the HIC and PIT count, and how to access resources on the HUD OneCPD resource exchange related to the HIC and PIT count. I'm now going to turn the time over to Mike Roanhouse to provide some context for today's HIC and PIT discussion.
Thank you, William. To start out, I want to briefly review what the HIC and the PIT are. The HIC, or the Housing Inventory Count, is a report that provides HUD with information needed to understand the capacity to house persons who are homeless at the local and national levels. The PIT, or point-in-time count, provides HUDs with data needed to understand the number and characteristics of persons who are homeless at one point in time. Together, the HIC and the PIT paint a picture of the supply of housing beds and units for the homeless community and the demand for that supply or inventory. These reports allow us to look at local, state, regional, and national data to discern the housing needs of homeless populations across the country and whether we, as the housing assistance community, are able to meet these needs. Abraham Lincoln once said, "If we could first know where we are and whither we are tending, we could then better judge what to do and how to do it." I don't think he was thinking about the HIC and PIT, but it might be worthwhile to follow his advice and briefly review where we have come from, where we are, and whither we have been tending to understand where we need to go and how to get there. As homelessness became a national issue with issues in the 1980s and 90s, there were several estimates of homeless persons presented. These estimates were derived from varying techniques and the early efforts by HUD and Census to count the homeless. These efforts generated controversy about the homeless definition, counting techniques, and whether any count was acceptable. In the 1990s, HUD responded to statutory requirements for determining local homeless needs by instituting regulatory and administrative reporting requirements for generating homeless PIT population and subpopulation estimates. The Consolidated Plan and the CoC competition became primary vehicles for communities to report this data for local planning and to HUD. As communities sought ways to obtain reliable homeless estimates, HUD was able to glean best practices from communities across the countries to help shape the national standards and guidance on counting methods. The standards today reflect HUD's learning from the groundbreaking work done by leading communities trying to get a handle on their homeless needs. The next big push for better data came in 2001 when Congress mandated HUD to help communities obtain quality information on the nature and extent of homelessness for both local and national planning. This resulted in new PIT standards for the timing of the count and the quality of the estimates. HUD also began implementation of homeless management information systems. This data was then used to develop national PIT estimates and annual sheltered estimates from HIMS data. This information was collated in a mandated report to Congress called the Annual Homeless Assessment Report, or AHAR. Now under HARTH, we are in a new era of homeless data usage. The HARTH Act pushes communities to use data to measure and report on performance. In addition, the new federal Opening Doors strategy on homelessness focuses goals on distinct subpopulations of the homeless. The PIT is one of the key data sources used to identify these subpopulations and to measure progress against goals. The tie-in to system and program performance makes it even more critical for communities to use the highest data quality possible. The reason we wanted to take a step back and remember this evolution of data collection and reporting is to see that it actually started with the quality of work done by communities. This had an impact on national decision makers and led to a drive for greater precision in data collection process. We congratulate the many communities that have been front runners in the effort to generate quality data, make data-driven decisions, and we appreciate the significant work you have done in the past and you continue to do now. HUD is in the process of approving its HIC and PIT data collection. The intent is to tighten the counting standards while providing more guidance and tools to communities to enact such changes. As provided in the CoC program rule, HUD is publishing the point-in-time guidance this year as an official notice as opposed to a guidance document. This has the effect of better aligning the PIT with HUD's CoC regulations and bringing greater authority to the requirements. The notice is applicable for the 2014 HIC and PIT and for future counts unless otherwise amended. While HUD reserves the right to make changes for 2015 and other counts, at this time we intend to apply this notice to future counts without any changes. Well in advance of the 2015 count, HUD will confirm whether it will be using the existing notice or issue an amended notice. This allows communities to solidify their planning earlier and will result in a better and more consistent count. Given the current counting requirements outlined in the notice, communities must find some way of surveying both sheltered and unsheltered populations. While HIMS continues to be a good resource for most communities to determine the nature of their sheltered populations, communities generally need to survey their unsheltered population to meet HUD's reporting requirements and to better understand the unsheltered homeless population. To assist communities to develop the most effective surveys, HUD is releasing a set of sample surveys communities can administer, as well as a mobile application communities can adopt. The mobile application is currently configured to assess communities conducting counts on the night of the count and will be updated in the future to include service-based surveys as well as sheltered surveys. These tools are optional, but HUD encourages communities to take advantage of them to facilitate an effective count. HUD is also in the process of reevaluating PIT counting methodologies, including having extensive discussions with the U.S. Bureau of Census experts. HUD will be releasing a point-in-time methodology guide to replace the existing sheltered and unsheltered counting guides. This methodology guide will establish more clear standards for communities and will provide helpful guidance on counting, planning, implementation, and analysis. This guide will apply to the 2015 count. As stated in the previous slide, this notice informs continuums of care of the information that must be collected in order to successfully complete the HIC and the point-in-time count for 2014, and future counts this notice applies to. This notice creates additional requirements for point-in-time counts and further guidance on how to complete the housing inventory count. The HIC and PIT data play a critical role in the CoC program competition, and HUD will continue to emphasize through its scoring the significance of the data reported as well as the process for data collection. However, HUD deems most important the quality and accuracy of the count as opposed to merely the size of the count. As CoCs begin to organize and plan these activities, CoC staff should review this notice and use it as a reference to ensure the CoCs are capturing all the information HUD is requiring. Not required for 2014, CoCs are encouraged to also conduct a point-in-time count of unsheltered persons. CoCs that choose to conduct an unsheltered point-in-time count for submission to HUD in 2014 must still comply with HUD's counting requirements. CoCs will submit their HIC and PIT data via HUD's Homeless Data Exchange, the HDX, in the spring following the count as a part of the CoC program competition for the year of the count. Additional guidance on the 2014 submission process will be released at a future date. I will now turn over the time to Tom Albanese to discuss the housing inventory count guidance.
Great, thank you, Mike. As Mike indicated, to better align program components with the CoC program interim role, certain changes have been made to the housing inventory count and PIT guidance. Specifically, some of these changes that we would like to talk about today relate to permanent housing. Permanent housing has been added as a program component to the HIC, consistent with the rule. Permanent housing is community-based housing, the purpose of which is to provide housing without a designated length of stay. Permanent supportive housing, or PSH, and rapid rehousing, RRH, are distinct project types under the permanent housing component, along with a new type, other permanent housing. For the HIC, other permanent housing projects include projects with beds or units dedicated to serve the homeless that do not otherwise meet the PSH and RRH project type descriptions included in the notice. And we'll discuss this in a moment. For purposes of the HIC, CoC should only count RRH beds and units for which rental assistance from any source is being provided on the night of the count. This is a change from prior guidance when CoCs were asked to report all RRH beds and units regardless of whether rental assistance was being provided on the night of the count. Additionally, for the 2014 HIC, HUD-funded rapid rehousing demonstration projects, or RRHD projects, funded in the fiscal year 2008 CoC competition, should be categorized under a new, unique project type called DEM, or DEM. As this is not a current project type in HMIS, CoCs using HMIS to generate their HIC data may need to manually change the project type in the HIC to the DEM project type. It should be noted that there are only 23 rapid rehousing demonstration projects that were funded in the fiscal year 2008 competition. So this applies to a very limited number of CoCs. Additionally, CoCs will need to identify the number of beds within projects that are dedicated to veterans and youth. In the past, CoCs were asked to report the number of beds dedicated to persons who are chronically homeless. This year, in addition to that, CoCs will have to also report on the beds and units dedicated for veterans and youth. For dedicated youth beds, CoCs need to indicate the age group that the beds are dedicated to serve. In other words, broken out by beds for only children under 18, for youth ages 18 to 24, or for persons up to age 24. In addition, with the addition of veterans bed count, the veterans target population under target population B has been removed from the HIC, since identifying the number of beds dedicated to veterans serves the same purpose and provides more precise information about project targeting. Lastly, in terms of changes for the HIC, the term provider program has been changed to project throughout the guidance. which is consistent with language and nomenclature used in the COC program interim rule and other HUD guidance. Now I'd like to talk a little bit about some important points relative to the HIC that are critical to keep in mind as you're collecting your inventory data and reporting it to HUD. For the purposes of the HIC, a project with dedicated beds and units is one where, one, the primary intent of the program is to serve homeless persons. Two, the program verifies homeless status as part of its eligibility determination. And three, the actual program clients are predominantly homeless. This is important to keep in mind as you're putting together your HIC inventory data. Remember that beds in institutional settings, not specifically dedicated for persons who are homeless, such as detox facilities, emergency rooms, jails, and acute crisis or treatment centers, should not be included in the HIC. At the same time, HUD considers extreme weather shelters as dedicated homeless inventory, and these should be included in the HIC. Overall, it's important to keep these three criteria in mind when determining what to include and what not to include in your HIC. There may be occasional instances where a project with dedicated beds serves a non-homeless person, and beds in these types of programs may still be counted as dedicated beds. For example, a project that's intended to serve persons who are both homeless and intoxicated may be unable to determine homeless status at entry due to a person's severe intoxication. After admission, the project may determine that the participant is in fact not homeless and helps them return to their housing. In this instance, the project bed may still be counted as a dedicated bed for homeless persons, since it was only incidental that a person was admitted who in fact turned out not to be homeless. When putting together your HIC, it's important to keep in mind the specific project types that are recorded in the HIC. These include emergency shelter, which consists of emergency shelter beds and units that are designated to serve people who are homeless and are recognized as part of the formal homeless system. The HIC also includes transitional housing projects, including the beds and units in those projects, safe haven projects, which are specific types of projects that satisfy HUD standards and the HUD definition of a safe haven, as identified and defined in the 2009 COC program NOFA, or the Homeless Assistance Program NOFA at that time. And then, of course, there's permanent housing. And permanent housing, as I noted earlier, has three distinct subcategories: permanent supportive housing, rapid rehousing, and other permanent housing. I'd like to share a little bit more detail about each of the permanent housing types, subcategories, which are explained in detail as well in the notice. Permanent supportive housing, or PSH projects, include permanent housing in which supportive services are provided to assist homeless persons with a disability to live independently. PSH can only provide assistance to individuals with disabilities and families in which one adult or child has a disability. In addition, supportive services designed to meet the needs of the project participants must be made available to project participants. Permanent housing projects that provide supportive services but do not limit eligibility to individuals with disabilities and families in which one adult or child has a disability should be identified as other permanent housing projects, the new category, in other words, under this permanent housing category, but not permanent supportive housing projects. This is a key distinction. The definition here is consistent with HUD's definition for permanent supportive housing contained in the COC program interim rule. For rapid rehousing projects, Those include projects that provide supportive services and or short-term, which may be up to 3 months, and or medium-term, up 3 to 24 months, of rental assistance as necessary to help a homeless individual or family with or without disabilities move as quickly as possible into permanent housing and achieve stability in that housing. While there are differences between ESG-funded and COC-funded eligibility requirements, COC should include all McKinney-Vento-funded rapid rehousing projects on the HIC, including ESG-funded projects, as well as those seeking renewal funding through the fiscal year 2013 COC program competition that are classified as RRH. COC should also include non-HUD funded rapid rehousing projects, such as the VA's supportive services for veteran families, projects offering rapid rehousing assistance, if they meet the definition above. I'll talk a little bit more about rapid rehousing in a moment, but just to stress that the new category, other permanent housing projects, includes permanent housing dedicated for homeless persons, but that do not require a person with a disability to be served in the housing. And again, this is a key distinction to keep in mind. With regard to VA-funded programs and other veteran-specific programs in the HIC, as with last year, COCs need to include all VA-funded programs in their HIC. The VA programs should all be reported with the appropriate prefix for the program as listed in the table on the slide. This is consistent with last year and should be familiar to COCs. A detailed list of projects, project types, and these prefixes can be found in Appendix A of the data collection notice. COCs should include prefixes even if only a portion of the program funding is received from the VA. So there may be times or projects that receive just a portion of their funding from the VA and other funding from HUD or other sources. In these instances, a VA prefix should be used for the program. I'd like to talk a little bit about the relationship between HMIS and HMIS use to generate the HIC. According to HUD's Homeless Management Information System data standards updated in March 2010, all homeless assistance and homelessness prevention programs that are part of a COC's homeless system must have program descriptor data recorded in the COC's HMIS. Program descriptor data recorded in HMIS, which includes bed and unit inventory data, should be used as a starting point for completing the HIC. There are additional data elements, however, that are not collected or may not be collected in HMIS and are not included presently in HUD's data standards that COCs may need to update in the HDX and in their HMIS. This includes the DEM project type for rapid rehousing demonstration program projects and the other permanent housing project type, which is a new project type. Additionally, McKinney-Vento funding may need to be added to your HMIS data set, and the number of beds dedicated to households with only children. Many COCs can complete their HIC using their HMIS data, and HUD certainly encourages communities to use their HMIS data to the greatest extent possible. With regard to HMIS, it's important to remember that an HMIS participating bed, which also has to be reported in the HIC, has to meet a very specific definition to be counted as an HMIS participating bed. A bed is considered HMIS participating if the project makes a reasonable effort to record all universal data elements on all clients served in that bed and discloses that information through agreed upon means to the HMIS lead agency at least once annually. for projects that served a mixed population without a fixed number of beds per household type, record the participating beds according to the household type instructions included in the notice. HMIS participating beds should be identified for year-round beds, seasonal beds, as well as overflow beds. And now, related to rapid rehousing bed and unit inventory, I wanted to share a little more detail about how to identify that inventory and report it. It's important to remember that on any given night, a rapid rehousing project will have current participants who are still homeless. In other words, participants who may still be staying in a shelter or on the street and who are seeking permanent housing, as well as participants who have already located permanent housing and are living there presently. For the HIC, rapid rehousing project beds and units are equivalent to the number of permanent housing beds and units occupied by rapid rehousing participants on the night of the count, and for which the rapid rehousing project is providing rental assistance from any source, HUD, VA, or any other source. Therefore, CoCs should only count rapid rehousing beds and units based on the actual number of current participants being served on the night of the count who are actively enrolled, who are no longer homeless and are in permanent housing on the night of the inventory count, and who are receiving rental assistance from the rapid rehousing project. However, remember that there are some additional screens that have to be applied to VA rapid rehousing projects. Specifically, the Support Services for Veteran Families Program, SSVF, and the Veterans Homelessness Prevention Demonstration projects. These projects may offer both homelessness prevention and rapid rehousing assistance and may intermingle participants in the same project in HMIS. Therefore, CoCs must also limit SSVF and VHPD rapid rehousing project inventory to participants whose housing status at program entry is literally homeless. This allows a CoC to identify those participants who were enrolled and are receiving rapid rehousing assistance. With regard to the bed inventory, as I mentioned, HUD this year for the 2014 housing inventory count is also requiring CoCs to report the veteran and youth inventory within their bed inventory. I'd like to take just a moment and explain how to record the chronic homeless bed inventory, the veteran bed inventory, and the youth bed inventory. The chronic homeless bed inventory includes the number of PSH beds that are dedicated to house chronically homeless persons. A dedicated bed is a bed that must be filled by a chronically homeless participant unless there are no chronically homeless persons located within the geographic area. The number of beds for chronically homeless persons is a subset of the total PSH bed inventory for a given project and must be equal to or less than the total bed inventory. The veteran bed inventory, similar to the chronic homeless bed inventory, includes the number of beds that are dedicated to house homeless veterans and their families. A dedicated bed, similar to a chronic bed, is a bed that must be filled by homeless veterans and their families unless there are no homeless veterans and their families located within the geographic area. And again, the total bed inventory for veterans may be a subset of the total project inventory and should be equal to or less than the total project bed inventory. The youth bed inventory, again, similar to the chronic homeless bed inventory and the veteran bed inventory, includes dedicated beds for homeless youth that must be filled by a homeless youth unless there are no homeless youth located within the geographic area. The number of beds for youth may be a subset of the total bed inventory for a given project, and again, should be equal to or less than the total bed inventory. Additionally, CoCs will have to identify if the beds are dedicated to serve only children under 18, only persons 18 to 24, or persons up to age 24, which includes both children under 18 and persons 18 to 24. If a project is intended to serve anyone up to age 24, even if it has an earlier cutoff age, let's say age 21, that project should indicate that it serves only persons age 18 to 24 or persons up to age 24, depending on the lower age limit of persons the beds are dedicated to serve. It's important to remember that projects serving runaway and homeless youth should exclude beds that are dedicated for persons who are wards of the state, which includes children in foster care or who are otherwise under government custody or supervision. If beds are not specifically dedicated, then the COC must prorate beds based on use on the night of the count or prorate based on average utilization. Additional guidance can be found and instruction concerning this matter in the notice. And now I'd like to hand it over to William Snow, who will talk about the point-in-time count.
Thank you, Tom. Let's start discussing the PIT count material by reviewing HUD's changes for requirements since last year. In 2014, COCs must collect data on and report the gender, race, and ethnicity for all sheltered and unsheltered persons. COCs must also collect population data on veterans and their households, including gender, race, and ethnicity data for veterans. Because COCs will be reporting more detailed data on veteran households, the count of veterans as part of the subpopulation requirements have been removed. The term disability has been added to Appendix B of the notice, and the subpopulation categories for chronic substance abuse and severely mentally ill have been revised. These changes have been made to ensure consistency between terminology for PIT count purposes. COCs that have rapid rehousing demonstration projects must not include persons in those projects in the PIT count. In the past, such projects would have been included in the transitional housing inventory. The HIC and the PIT are integrally related. Beginning this year, the sum total of persons reported in emergency shelter, safe havens, and transitional housing projects in the PIT fields of the HIC will be required to match the sum total of sheltered persons reported in the PIT count. Any discrepancies between the number of sheltered persons counted on the HIC and the number of sheltered persons counted on the PIT will result in a validation error, requiring the COC to correct the discrepancy in HDX. COC should be conducting their HIC and PIT counts on the same night in order to best align these counts. HUD released sample surveys and a mobile PIT app and encourages communities to review these tools and determine if and how to incorporate them into your counts. However, as stated earlier, these tools are optional. The PIT count should be completed using unduplicated counts or statistically reliable estimates of homeless persons in sheltered and unsheltered locations on a single night. HUD requires that PIT counts be conducted in compliance with HUD counting standards and related methodology guidance, as described in HUD's A Guide to Counting Sheltered Homeless People and A Guide to Counting Unsheltered Homeless People, available on HUD's OneCPD Resource Exchange. Remember that HUD will be publishing updated methodology guidance that will apply to the 2015 count. Compliance with HUD standards may result in a more accurate and potentially higher or lower PIT count than in the past. COCs will have the ability to explain changes in PIT counts that are due to methodology improvements in the COC program competition application, and HUD will take such changes into account in the application review and scoring process. Questions about whether your community's counting methodologies meet HUD's requirements as outlined in the guidance should be submitted to Ask a Question in the OneCPD Resource Exchange. COCs are encouraged to use HMIS to generate their sheltered count where possible. More guidance on this is provided in the notice. For the sheltered count, CoC should include all the individuals or families who meet the criteria at CFR 91 of the homeless definition final rule. This includes people living in supervised, privately or publicly operated shelter, designated to provide temporary living arrangement, including congregate shelters, transitional housing, and hotels and motels paid for by charitable organizations or federal, state, or local government programs for low-income individuals on the night designated for the count. This also includes people residing in safe haven projects. Note that rapid rehousing is considered a permanent housing. However, homeless households currently residing on the street in an emergency shelter, transitional housing, or safe haven that are enrolled in a rapid rehousing project but awaiting placement should be counted based on where they resided on the night of the count. Thus, rapid rehousing assisted households who are still unsheltered on the night of the count should be included as part of the unsheltered count. The unsheltered count should include all individuals or families who meet the criteria at CFR 91 of the homeless definition final rule. This includes persons with a primary nighttime residence that is a public or private place not designated for or ordinarily used as a regular sleeping accommodation for human beings, including a car, park, abandoned building, bus or train station, airport or camping ground on the night designated for the count. Just as important as knowing who to count is knowing who not to count. People residing in the following settings on the night of the count are prohibited from being included in the sheltered or unsheltered PIT count. Persons residing in permanent supportive housing programs, including persons housed using VASH vouchers. Persons counted in any location not listed on the HIC. For example, staying in projects with beds or units not dedicated for persons who are homeless. Persons temporarily staying with family or friends, such as being doubled up or couch surfing. Persons residing in housing they rent or own, like permanent housing, including persons residing in rental assistance or rental housing with assistance from a rapid rehousing project on the night of the count. Persons residing in institutions, for instance, jails, juvenile correction facilities, foster care, hospital beds, and detox centers. CoCs must collect and report counts of specific subpopulations among sheltered and unsheltered persons according to the chart identified in the notice. Subpopulation data should be limited to adults with the exception of persons in chronically homeless families. CoCs must collect data for all subpopulations except victims of domestic violence. While the HUD certainly encourages CoCs to collect and report on victims of domestic violence, we want to be cognizant of the sensitivity of collecting data and reporting on victims of domestic violence. To ensure accurate data collection, HUD requires that CoCs collect subpopulation data consistent with the definitions in the notice and in compliance with HUD counting standards. This allows CoCs and HUD to accurately measure progress against opening doors, the federal strategic plan to prevent and end homelessness. We've listed several PIT and HIC resources for communities on this slide. It's absolutely necessary for CoCs to review the notice and understand HUD's requirements for the 2014 count and likely for future counts, as Mike mentioned earlier. Additionally, we encourage you to look at the other tools listed on this page to help you conduct the more effective and accurate count. We recently published the point-in-time survey tools resource page on the OneCPD Resource Exchange. On that page, we provided 4 model survey instruments as well as a link to the web-based version of the mobile PIT app. We anticipate releasing the mobile app itself to Google Play and the Apple Store in the coming weeks. As a reminder, if you have additional questions, please submit them through the OneCPD Ask a Question feature. You can obtain information or assistance from the OneCPD Resource Exchange by searching the resource library, checking out OneCPD News, using the Ask a Question function, or requesting technical assistance. Thank you for participating in this presentation, and good luck with your counts.